let's bring in right now former director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci. He previously served as the chief medical advisor to the president. Dr. Fauci, thank you so much for being with us. Those clips, they remind me of what my mom always told me. She said, Joey, judge yourself by your enemies. So I pass my mother's wisdom on to you. And let me just ask you, I know it's radical, but let me ask a doctor a medical question. How are we doing in the COVID battle right now?
Well, we still have an issue that we're having more deaths than many of us in the public health sector feel are acceptable. But if you compare, Joe, with where we were a year and a half ago, we're much better. Remember, we were having about 800 to 900,000 infections a day and about 3,000 to 4,000 deaths per day. We're much further down than that right now. We're doing, comparatively speaking, much better. But we can do better than we're doing. We've got to get that death rate, which is around 400 or so, sometimes as high as 500, sometimes down to 300 per day. We've really got to do better than that. I mean, if you look at the relative percentage of people who are updated on their boosters, we have less than 20% of the eligible people have received that updated BA.4/5 boost. So we've got to do better than that, even though we're doing much better than we were.
It seems to me that the steady stream of disinformation keeps moving out there. A lot of people picked up on a Cochrane summary of mask studies and ran with that a couple of weeks ago and said, see, this proves masks don't work. The Cochrane editor-in-chief had to come out and say, no, you're misreading our data. That's not what we're saying at all. And yet that disinformation gets out of the door and people just run with it. Looking back, we've learned a lot of things over the past 3 years. Tell me, what are some of the major takeaways that you've learned over the last 3 years? Perhaps some things that before we knew exactly how COVID was going to develop. What have you learned 3 years in about COVID?
Well, there's a long, long list, Joe, of what we've learned, and particularly if you look at the evolution of information from the very first weeks when it was felt that this was not a particularly easy virus to transmit from person to person, feeling that it was, maybe jumped from an animal to a human, and one human would infect another, but very inefficiently. Then we soon found out that it is extremely efficient in its transmissibility. Then we found out that unlike influenza, which is mostly droplet transmission, this is aerosol transmission, which really changed how we looked upon the need to wear a mask when you have aerosol transmission. And then the other thing that we learned as the weeks went by is that this virus is transmitted predominantly, 50 to 60% of the transmissions are from someone who has no symptoms at all, which completely smashes the paradigm of respiratory transmissibility that we're used to with other respiratory-borne diseases. And then the big surprise of all, when we expected that it would go up and then go back down and then sort of disappear and go into the background, we wound up having variant after variant and surge after surge, right up to what we're having right now, which are sublineages of the Omicron surge, which started well over a year ago. So this has been really a moving target. And that's the reason why we've had to many times change some of the things that we said and recommended. People saying that's flip-flopping, but it isn't. It's learning as you go along and making your recommendations according to the new data as it evolves.
Right, and it's ever evolving and evolving very quickly. It's just like vaccines. People will still go, you got COVID, even though you got a vaccine. Well, we didn't know. None of us knew. You didn't know exactly how those vaccines would impact the virus. But we've learned quite a few things about the vaccines, too. There's a very resilient virus. It's a very durable virus, and it morphs very quickly. So develop a vaccine, and it still helps in a positive way, but it doesn't wipe out COVID. Can you explain what we've learned about vaccines over the last 2 years?
Well, there's one very, very obvious fact that is borne up by very solid data. Joe, we know that if you compare unvaccinated people with vaccinated people with regard to hospitalizations and death, there is an overwhelming and dramatic difference of a greater likelihood of hospitalization and death among the unvaccinated. And as the months went by, if you compare vaccinated but not up to date with boosters with people who are totally up to date on boosters, there's still a difference in the sense of vaccinated and updated boosted people do much better with regard to severity of disease. That's an open and shut case. There's no doubt about that vaccines work. But there's another thing that is a bit sobering that we learned, that this virus is so highly transmissible that when you're vaccinated, you may not necessarily get protected against infection, but clearly you get protected against severe disease. And that's caused a lot of confusion among people, because when we went from the original wild type or ancestral strain of the virus that was spreading in January and February of 2020, as we evolved into different variants, including Omicron, it became much more transmissible, not necessarily more serious, but more transmissible. So people who were vaccinated were getting infected. But the critical issue that should not be lost is that the vaccination clearly prevented them, for the most part, from getting severity of disease. Those are the kind of things, Joe, that you mentioned, that as the months and the years went by, we learned more and more. And when you learn more and more, you've got to keep up with that information.
Well, it keeps moving, Mike Barnicle, and I just want to underline really quickly what Dr. Fauci said, because it is so important, because there's so much disinformation going on out there, especially about the vaccines. The thing is, the vaccines help curb the severity for the overwhelming majority of people that get the vaccines. Of course, some elderly people obviously will still have challenges. Others will still have challenges. But the data is just so clear. And I know there are people out there that spread disinformation daily. But because it's not black and white, it seems that they move to this more radically. But the fact is, it makes, for most Americans, the reaction less severe.
Yeah, well, that leads to the question, Joe, and would like the answer from you, Dr. Fauci, who you're the pride of Holy Cross College, and I don't believe you were in medical school with Ted Cruz or Jim Jordan, but how many booster shots do you think we will be getting? There's one available now, but how long in the future will we be getting booster shots?
You know, we don't know definitively the answer to that, but it is likely that this thing is not going to disappear. It's not going to be eradicated, and it's not going to be eliminated. So it's going to be around, you know, for the foreseeable future. So it is likely that we will require an intermittent, likely at the same time as we get a flu vaccine, at least once a year, very similar to what we do to keep updated on our immunity against influenza. It is very likely that the similar situation we'll be experiencing with COVID, namely getting a booster shot once a year, probably at the same time as we get an influenza shot.